A very good morning to everyone. This is Dr. Rashmi Bhadra presenting the topic drug utilization pattern of anti-glaucoma drugs in patients attending ophthalmology OPD in a tertiary care center, which is a hospital-based cross-sectional study. So as we know, glaucoma is the second most common cause of blindness worldwide after cataract, and the prevalence of glaucoma ranges between 2.7 to 4.3% among Indians, and the prevalence is more in older age groups. And it is the leading cause of irreversible blindness in India. And the treatment preferences mainly include the beta blockers like timolol, carbonic anhydrase inhibitors like dorzolamide, alpha-2 agonists like brimonidine, and prostaglandin analogs like latanoprost. So studies regarding this drug utilization pattern are limited in this region of southern Odisha. Hence, our study aims to evaluate the drug utilization pattern of anti-glaucoma drugs in our study population. So as I told, this is a hospital-based cross-sectional study which was conducted from September 1st to October 31st, 2023 after taking prior ethical approval from Institutional Ethics Committee. The study population included the patients of any age and gender diagnosed with glaucoma and who consented to participate. So based on previous literature studies and the prevalence of glaucoma, the sample size was estimated to be 70, and the study outcomes analyzed were number of drugs per prescription, most commonly prescribed drug classes, distribution of monotherapy versus combination therapy, and the proportion of prescriptions using generic name versus branded name. A standardized case record form was used for data collection, which included the patient's demographic details, clinical characteristics, and prescribed medications. The study tools used are WHO core prescribing indicators, which has 3 parameters, which we will subsequently see, and the ATC and DDD system by WHO, that is anatomical, therapeutic, chemical classification, and the defined daily dosing system. The statistical analysis was done using Microsoft Excel and GraphPad Prism version 10. Similarly, the contingency statistical analysis was done by Fisher exact test. And for number and percentage, descriptive statistics was used. So now coming to results, here in table number 1, we can see the demographic parameters of study participants, which reveals the female preponderance. Similarly, the patients who between the age with age group more than 50 years or more. Similarly, the prevalence of open angle glaucoma is more than closed angle glaucoma. Now coming to table number 2, that is drug use indicators of study participants, from which we can see that the average number of drugs per prescription was 1.63, which was well within the range of WHO reference value. Similarly, all the prescriptions of our study participants were prescribed with the generic drugs and drugs from National List of Essential Medicine list. Now coming to figure 1, the prescription pattern among study participants, from which we can see that the percentage of prescriptions with combination therapy was more, that is 58.57%. Similarly, in prescriptions with combination therapy, the combination of brimonidine and timolol was more prescribed than the combination of dorzolamide and timolol. Now table number 3 depicts the anti-glaucoma drugs prescribed as monotherapy to the study population with their ATC code and defined daily dose. So from which we can see that there were mainly 3 classes of drugs which were prescribed as monotherapy, like carbonic anhydrase inhibitors, beta blockers, and prostaglandin analogs. Now in table number 4 and 5, the Fisher exact test, which shows that there was no association between gender distribution and age groups with combination therapy and monotherapy. Now coming to discussion part, in our study, most participants had received combination therapy, which reflects an approach aimed at achieving better and faster intraocular pressure lowering through multiple mechanisms of action, which is evident with studies done by Nokor RJ and Higginbotham EJ. Similarly, timolol with brimonidine was the most commonly prescribed combination of drugs, and dorzolamide was most commonly prescribed as monotherapy, which concords with the study done by Mamgen V. et al. But the study published by Tianjin et al. States that prostaglandin analogs like latanoprost had greater efficacy in reducing intraocular pressure than dorzolamide, which differs from our study finding. So in the WHO core prescribed indicator parameters, our study fulfills all the 3 criteria. So our study depicts the included patients of all age groups, so it covers the wide demographic range, and it understands the glaucoma prevalence and helps in understanding the glaucoma prevalence and treatment patterns across different demographic groups. Similarly, it provides us with combination therapy insights, which highlights the specific drug combination used in practice, and it also focuses on rational drug usage. But our study has one limitation, that is the cost benefit and cost effective analysis could not be performed, as all the patients received the drug freely from the hospital supply. So to conclude, we can say that in this tertiary care center, dorzolamide was the first line choice for monotherapy, and timolol and brimonidine was the most commonly prescribed combination therapy. The study emphasizes the rational use of medication and highlights the importance of other treatment guidelines in clinical practice. Thank you.